The world is changing. With social media, people increasingly want to have a say in all aspects of their lives. Nowhere is that more true than healthcare. According to the Institute of Medicine and the Affordable Care Act, patients need to be the source of control of their healthcare experiences. At IFG Health, we give people the tools of control, tools that help them to organize and humanize their healthcare so they can truly say, "I feel great." On our website, you can find videos about the apps we've got working or are working on. Right now, I'm going to talk to you about one of our tools, an app called the IFG Provider Journal. The Provider Journal is for helping you to organize your visits with healthcare providers. As you can see, the journal is divided into 4 parts. There's a place for you to input questions and notes you have before the appointment, and to upload a picture that may illustrate a problem or complaint. At the top is a place for you to input the vitals that are taken when you first arrive at the office. The appointment notes section is where you can record your discussions with the doctor. These are usually the whys and hows of your medical condition. You can make quick notes and flesh them out later, or you can have a family member complete this section. The care plan is the place where you write down the plan you and your provider jointly come up with to deal with your problem. The last section, results and feedback, is a place for documenting what in the care plan worked and what didn't. This information is important for follow-up visits and future treatment. Why use the IFG Provider Journal? It can help you save money. Reader's Digest recently wrote about the importance of taking notes when you're in the hospital. You can obtain similar advantages by making notes when you visit a healthcare provider in their office. And IFG will soon come out with a hospital journal to help you when you're an inpatient. It turns out that a lot of people keep an analog healthcare journal. This approach works, but searching for the right information is difficult to do quickly with a pencil and paper notebook. I found that in the exam room, you have between 10 and 15 seconds to find the information you need, or your doctor will move on without it. The IFG Provider Journal allows you to easily scroll between and search through all your appointments. The ability to search makes it easier to spot trends. A friend of ours had a sore throat. His wife looked back through their healthcare journal and noticed that he'd had a sore throat at the same time every year for the past 5 years. When they brought this information to the attention of their doctor, the doctor realized it wasn't an infection as he thought in the past. It was an allergy. The complaint was retired for good. A lot of people point out that providers now use electronic medical records, EMRs, that record much of the same information. But doctors don't want to be looking at a computer when you see them. From the moment they enter the examination room, they've focused all their senses on you. With the IFG Provider Journal, you can get the information your provider needs while they continue to do what they do best. Additionally, your provider may not be comfortable with searching for the information in the EMR. At a recent visit, a doctor asked me for some information which was available from the EMR, which for him was just a swivel away. But he didn't turn around to look for it. I realized later it was most likely because the doctor's assistant was the one trained to use the EMR. She brought up the one screen the doctor would need to use, and then she left the room. If he'd navigated away from that screen, he would have been lost. And he would have felt foolish in a situation in which he wanted to be the expert. Another advantage of putting a health journal in patients' hands is it allows them to include all the providers they see. Chiropractors, massage therapists, herbalists, physical therapists, all of them. The advice and care plans from these complementary and alternative practitioners doesn't end up in your doctor's record. Finally, the IFG Provider Journal provides a check on the accuracy of your EMR. Recently, a friend was facing a difficult surgery and asked for a copy of her medical record. She went down line after line and thought, "This is pretty good," until she got to an entry that read, "At this point, the patient turned to her son and daughter and discussed the surgery with them. They all agreed the procedure was necessary." Only problem was, our friend doesn't have any children. EMRs don't eliminate mistakes. Patient record keeping is one way to keep track of your side of the story. IFG Health aims to create a worldwide revolution in healthcare by empowering patients and providing them with tools that give them the information they need to successfully manage their healthcare encounters. We do that by helping people to organize and humanize their healthcare experience. I'm Steve Deal, CEO. These are some of the things we think about at IFG Health. Let us know what you think.